Here's a statistic that might surprise you. About 25% of my facelift patients are now in their 40s and 50s, not their 60s and 70s. The entire approach to facial aging is shifting to a more proactive, preventative approach. Hi, my name is Dr. Roy Kim, a board-certified plastic surgeon in San Francisco and Beverly Hills. And today, I want to share why many facelifts and endoscopic procedures may be changing the way we think about staying youthful. If you've ever wondered whether you should wait until you're older for facial plastic surgery, this video may change your perspective entirely. The old philosophy was wait and correct. Let aging happen, then fix it with major surgery. Today's approach is more about prevention and maintenance. Think of it like preventive health care for your face. My patients are educated, successful, and busy. They understand that smaller interventions earlier can maintain their natural beauty without the dramatic downtime of traditional surgery. They're not trying to look 20 again. They want to look like the best versions of themselves at their current age. A mini facelift, also called a short scar facelift, focuses on the lower face where we first notice aging, those early jowls and slight loss of jawline definition. Instead of the extensive surgery of a traditional facelift, I can make smaller incisions and work with what I call the SMAS layer. Think of the SMAS as a deeper support structure of your face. We tighten this layer through limited incisions, usually around the ears. The recovery is very fast. In other words, less swelling, usually about 7 to 14 days instead of 2 or 3 weeks. However, it's important to understand that this works best for patients with good skin quality, early signs of aging, and not advanced sagging. Now, let's talk about endoscopic brow lifts. This is where technology really shines. Instead of larger incisions, I can use tiny cameras and instruments through small incisions hidden in your hairline. This technique borrows from other surgical specialties and has revolutionized brow lifting. The endoscope, the tiny camera, lets me see exactly what I'm doing while I gently lift and reposition the tissues that support your eyebrows. The results are beautifully natural because we're not removing skin. We're repositioning the deeper structures. However, this technique really works best when you need lifting in the upper third of your face and not when there's excess upper eyelid skin or the forehead skin needs to be removed or your forehead actually needs to be made physically smaller. Success with these minimally invasive techniques comes down to one thing: the right candidate. The ideal patient has good bone structure, quality skin elasticity, and realistic expectations. I always tell my patients, these procedures give you natural enhancement, not a dramatic change where no one recognizes you. You'll look refreshed, rested, and like you had a great vacation, not like you've had obvious surgery. It's about maintaining your natural beauty as you age, not trying to look like someone else entirely. The revolution in facial rejuvenation isn't really about more dramatic results. It's about smarter, more natural approaches that fit in with your busy life. So whether you're considering a mini facelift, endoscopic brow lift, or even a deep plane facelift, the key is working with a surgeon who understands these advanced techniques and can guide you to the right choice for your unique features and lifestyle. So now I'm curious, at what age did you first start thinking about facial rejuvenation? Share your thoughts in the comments below. Stick around for part 4 of my Facelift series. We're going to explore how modern neck lifts integrate with facial procedures for a complete harmony and a holistic approach to facial rejuvenation. True facial rejuvenation addresses both areas at the same time. If you like this video, I think you're going to like these other ones on my channel as well. As always, thanks so much for watching.